Hello, and welcome to 5 Minute Videos, study for the NCE. Today's area of focus is clinical, and we are in Q, maladaptive eating behaviors. Maladaptive eating behaviors, first of all, let's start off with the definition. It's a type of eating due to emotional states, and those can include things such as fatigue, boredom, as well as external factors. Emotional eating is associated with maladaptive eating behaviors, and that frequently occurs when a person has symptoms of depression, anxiety, loneliness, and anger. And these emotional eatings or maladaptive eating behaviors can then correlate with things like stress, and a lot of the anxieties and depressive in the DSM. Also, it's important to keep in mind that maladaptive eating behaviors can then trigger different experiences such as fatigue, boredom, a desired at a distance, or kind of an adverse reaction. And then what the DSM defines as external eating is eating in response to a food related stimuli, or eating as a way of coping regardless of your state of hunger or your satiety. So you're having these different terms: maladaptive eating behaviors, emotional eating, as well as external eating. But again, all of these are kind of correlated with one another. And then it's also important to keep in mind that eating behaviors are then associated with physical conditions such as overweight and obesity. And as you can imagine, it accumulates over time, and there's physical harms as well as psychological harms to the maladaptive eating behaviors. And also, it's important to keep in mind that there are different factors such as gender, race, socioeconomic factors that could play a role into the maladaptive eating. One of the diagnosis of the DSM-5 with the maladaptive behaviors is such things as binge eating disorder, which is where they overeat and then they throw up, or they do away with the consumption of food, and that can be that can have implications within their physical digestive system, and it can be very detrimental to individuals experiencing that type of behavior. As far as treatment for maladaptive eating behaviors, it's a very complicated situation, because not only do you have the physical, whether it's underweight, overweight, or obese, but you also have the psychological. And if you've ever seen shows like The Biggest Loser, you've noticed that a lot of times that weight that they lose, many times they regain it due to a lot of the psychological factors. So of course you're having medical interventions, you're having things like physical surgery, bypass surgery for the obese. But then you're also having mental health interventions to deal with some of the um, the perfectionism or the controls or a lot of the depression and anxiety. So it's really a complicated, multifaceted um, treatment with maladaptive eating behaviors.